Hi, and welcome to the Hormones Q&A channel. I'm a physician and I'm board certified in endocrinology and metabolism, as well as obesity medicine and internal medicine. This is a channel where I provide educational information about a variety of topics, including hormones, metabolism, thyroid, obesity, and more. The information on this channel is meant for educational purposes. It is not meant for diagnosis or treatment of any medical condition. Today, I'd like to talk about a question I receive very often, and that is, what is Hashimoto's disease or Hashimoto's thyroiditis? Hashimoto's thyroiditis is a very common medical condition, and there is a lot of bad information about Hashimoto's thyroiditis on the internet, unreliable information. Today, I'd like to just very simply answer the question as to what it is, and in other videos, I'll go into more detail about some of the information about how it's treated and also whether there's a role for certain other treatments that are often proposed in books and on web pages. So normally we have a gland in the center of the neck called the thyroid gland, which is sort of butterfly shaped, and it wraps around the front of the trachea, which is a tube that we breathe through and that brings air down to our lungs. And the thyroid makes hormones, which are collectively referred to as thyroid hormones, the most important of which are thought to be a hormone called T4 or thyroxine, and T3, which is also called triiodothyronine. These hormones, thyroid hormones, are released into the blood and affect many different parts of the body. So, for example, in the heart, they speed up your heartbeat. They cause your heart to beat harder. In the circulation, they cause blood vessels to relax. The net effect of these on blood pressure is to increase the top number of your blood pressure, called the systolic blood pressure, and to potentially decrease the bottom number of your blood pressure, which is called the diastolic blood pressure. Thyroid hormones also lower cholesterol, they speed up digestion, they have a role in muscle and bone health, they impact our skin and hair, making them smoother, they affect our mood, our cognition, meaning how clearly we think, or our memory. I could go on all day about what thyroid hormones do. They increase heat production and metabolism. They have a role in our development when we're in utero. And again, I could go on for the rest of this video just about things that thyroid hormones do around the body. But the point here is that thyroid hormones are released from the thyroid, travel in the blood throughout the body, can be converted from T4 to T3 in other parts of the body, and have a variety of actions. Normally, the thyroid is regulated by a gland in the center of your head called the pituitary gland. So this is the thyroid, and up here we have the pituitary gland. The pituitary gland, if you put a stick up your nose, you would encounter your sinuses. You've probably heard of a sinus infection. And if you push that stick through your sinuses, just before you hit your brain, you would hit the pituitary gland. And of course, you should not do that, but that is the location of the pituitary gland. The pituitary gland makes a hormone that is released into the blood, and it is called thyroid stimulating hormone. Thyroid stimulating hormone tells the thyroid to make thyroid hormones, and it also causes the thyroid to grow. Normally, if you're not making enough thyroid hormones, T4 and T3, the pituitary gland will respond to that by making more TSH to push the thyroid to work harder. And if you're making too much T4 and T3, the pituitary gland will respond to that by making less thyroid stimulating hormone. And that's how the thyroid function is regulated. There's another part of our body called the immune system. And the immune system has a function which is meant to leave alone all the normal parts of our body and to damage and destroy everything that does not belong in our body. So that's a very difficult task to ask for our immune system. Our immune system is not supposed to damage any normal parts of our body. Now, when the immune system infiltrates and damages the thyroid gland, that is Hashimoto's thyroiditis. So Hashimoto's thyroiditis, named after one of the scientists who helped discover it, Hashimoto. Thyroiditis means inflammation of the thyroid. And Hashimoto noted that the thyroid gland of affected patients contained lymphocytic infiltrates. So lymphocytes are a type of cell in the immune system, and it was these lymphocytes causing infiltration and inflammation. Itis means inflammation, causing inflammation of the thyroid. Hashimoto's thyroiditis is also called chronic, which means long-term, lymphocytic, which is the type of cell, lymphocytic, thyroiditis, again, inflammation of the thyroid. And depending on whether you include people with very, very mild forms of thyroiditis, chronic lymphocytic thyroiditis, where the thyroid is still able to do its job properly, this is a very common condition. So we find, if depending on what tests we use, we find antibodies to the thyroid, which is evidence of thyroiditis, in up to 20% of the female population. So it's more common, like many autoimmune conditions. Autoimmune meaning conditions where the immune system is affecting the self, your own body. Many autoimmune conditions are more common in female patients, and so we find evidence of Hashimoto's in up to 20% of females. So Hashimoto's thyroiditis is a form of long-term thyroid inflammation and damage. It is not always permanent. It can sometimes go away. Just to get a few definitions out of the way, when Hashimoto's causes the thyroid to be underactive, then that's called hypo meaning underactive, thyroidism, hypothyroidism. Not everyone who has Hashimoto's gets hypothyroidism. So if your immune system is damaging your thyroid gland, but your thyroid gland is still able to make enough hormone, then you have Hashimoto's without hypothyroidism. But if your thyroid gland is damaged by Hashimoto's to the point where it is underactive, then you have hypothyroidism. So hypothyroidism is less common than Hashimoto's because only a subset of Hashimoto's patients will develop hypothyroidism. On the other hand, nearly everybody with hypothyroidism has hypothyroidism because of Hashimoto's. There are some exceptions. A person could be hypothyroid because of surgery. So if your thyroid is partially or completely removed, then you may have an underactive thyroid or not enough thyroid hormone as a result. If you've had radiation to the neck area, sometimes that may, we think, increase the chance of Hashimoto's, or it may also cause hypothyroidism through radiation-induced damage to the thyroid gland. And in other cases, there may be rare genetic causes of hypothyroidism, but by far the most common cause of hypothyroidism is Hashimoto's. And when somebody has hypothyroidism without other apparent explanation, it can generally be attributed to Hashimoto's thyroiditis. So, what causes Hashimoto's thyroiditis? We have lots of evidence that the cause of Hashimoto's thyroiditis includes both genetic factors and environmental factors. And so what does that mean? Each of us inherits a certain genetic makeup through our DNA sequence, and there's strong evidence that there is a role for our genetic makeup in terms of who is at risk for Hashimoto's thyroiditis. For example, if you have Hashimoto's thyroiditis, then your siblings have a far higher likelihood of getting Hashimoto's thyroiditis. Or if your parent has Hashimoto's thyroiditis, there's a much greater chance of you getting Hashimoto's thyroiditis. Sometimes children get Hashimoto's thyroiditis before their parents. And also, we found that certain regions of DNA, certain areas of DNA involved in immunity play a role, that specific changes in certain sequences in genes involved in the immune system may be associated with an increased risk for developing Hashimoto's thyroiditis. We also see that relatives of people with Hashimoto's thyroiditis often have other autoimmune conditions, including other thyroid autoimmune conditions like Graves' disease or postpartum thyroiditis that I'll talk about in other videos, as well as some non-thyroid autoimmune conditions like vitiligo, which refers to non-tanning patches of skin, or celiac disease, which is a form of autoimmunity that affects the intestines in response to gluten in affected people. There are many others that I won't go into all of them. But we have a pretty clear role for genetics. On the other hand, it's not only genetic, and we know this for a variety of reasons, one of which is the fact that people who are identical twins, if your identical twin has Hashimoto's and you have the exact same genetic makeup as your identical twin, you have about a 30 to 60% chance, depending on the study, of getting Hashimoto's. So it's not 100%. It's not only your genes that determine whether you have Hashimoto's. Someone who is born with an increased risk for getting Hashimoto's does not always get it. And so what are the triggers? What are the environmental triggers that take someone who is at risk for Hashimoto's and causes them to get Hashimoto's? Well, we haven't fully worked that out. And for most patients, it is impossible to determine what caused their Hashimoto's in particular. But we question whether there's a role for sex steroids like estrogen, because women get this condition more often than men. For the same reason, we question whether there's something about the X chromosome, since women have one more X chromosome than men, that leads to increased likelihood of Hashimoto's. In animal studies, there are certain viral infections that can provoke Hashimoto's thyroiditis, and so we question whether that can be so in humans as well, although no specific virus that causes Hashimoto's has been determined. We think there is likely a role for stress in Hashimoto's. It is more clear with Graves' disease that stress may provoke the onset of Graves' disease. There have been many reports of that. In Hashimoto's, since it's such a long, slow process in most cases, it's really difficult to tell when it starts. But we think that stress may be a trigger for Hashimoto's. Iodine. So slightly low iodine may decrease the incidence of Hashimoto's, and very high iodine may provoke Hashimoto's. This doesn't mean that anybody with Hashimoto's should try to get less or more iodine. That actually can cause more harm than good. The thyroid gland can't make hormone without iodine, so having no iodine is a big problem. And too much iodine can also cause problems in patients with Hashimoto's by making it worse. So trying to manipulate iodine levels as a treatment often may do more harm than good. So in general, we're not sure what triggers Hashimoto's in any particular person, but we do have an understanding that there is a genetic cause that puts you at risk for it, as well as a trigger. One very interesting recent development is that we have medications that for cancer patients, so people who have cancer that is otherwise untreatable, sometimes can be treated using cancer medications. These are typically antibodies that boost the immune system. So cancer medications like one called ipilimumab work by increasing the immune system, and the purpose of this is to have your own immune system go after the cancer. And when cancer patients who have bad cancers and are given these medications, this is just one example of them, get their immune system ramped up, they often develop autoimmune conditions, including Hashimoto's thyroiditis. So the immune system is a delicate balance. Again, it's supposed to leave your body alone and go after things that don't belong there. When you rev up the immune system, we grow up being told by our parents that having a strong immune system is a good thing. But if we make it stronger than it already is using these medications, it sometimes may do too much. So in this case, it may damage the thyroid. Hashimoto's is not an immune deficiency. It doesn't mean that you'll be susceptible. If you have Hashimoto's, it doesn't mean that you'll be susceptible to infections because of a weak immune system. It actually means that the immune system is doing too much, in a way. It's doing too much. It's going after something that it ought not go after, in addition to doing the things that it should be doing. Hashimoto's itself, as I mentioned, can be very mild, where someone is unaware that they have it, where their thyroid is working properly, and where they feel well. It can be more pronounced to the point where it is causing an underactive thyroid. And in general, it can take one of two forms. It can cause a goiter, in which case it's called goitrous Hashimoto's. And this means that the thyroid is enlarged. Or it can be what's referred to as atrophic. And in general, this would mean that the thyroid is small. So not everybody with Hashimoto's thyroiditis gets a goiter, which is an enlarged thyroid. And in some cases, the thyroid may be normal in size, so sort of in between these two. So that's just a general introduction to Hashimoto's. Again, Hashimoto's tends to be a slow process. In nearly all cases, it is painless. Let's just quickly talk about laboratory studies in Hashimoto's thyroiditis. The great majority of patients who have Hashimoto's thyroiditis will have an abnormal antibody level to either thyroperoxidase or thyroglobulin. And in often cases, both. Thyroperoxidase is abbreviated as TPO in some lab forms, and thyroglobulin as TG. And so most patients with these antibodies to these antigens, these are small proteins in the thyroid, thyroperoxidase and thyroglobulin. Most people with Hashimoto's will have antibodies to one or both, the great majority. Not everyone, however. That doesn't necessarily mean that your doctor should check levels of these antibodies in your blood. Again, almost everybody with hypothyroidism, with an underactive thyroid, can be presumed to have Hashimoto's thyroiditis, even if they don't have these antibodies present. For example, if your mother has an underactive thyroid and takes thyroid medication for that, and you do as well, you almost certainly have Hashimoto's thyroiditis, and often cases it is totally unnecessary and likely unhelpful to check antibody levels. That said, if you happen to have antibodies to these antigens, either TPO and or thyroglobulin, then there is some sort of autoimmunity affecting your thyroid. And depending on how you define Hashimoto's, that may be enough proof in and of itself that you have at least mild Hashimoto's. When somebody has sort of borderline hypothyroidism, a little bit of hypothyroidism, checking antibodies and seeing that these antibody levels are very abnormal, very, very high levels of these antibodies, may help us predict whether someone's hypothyroidism is likely to get worse in the next few years. So it could have a role there. And going further into the role of antibody testing is really beyond what I want to go through in this video. But it's not necessarily the case that everyone with thyroid disease or with suspected Hashimoto should have them tested. I wanted to just conclude by talking about the fact that people who have Hashimoto's themselves may personally or have family members with other autoimmune thyroid disease, and we think that these are related. So Hashimoto's, as I mentioned, is chronic or long-standing lymphocytic thyroiditis. Postpartum thyroiditis is a type of what we call subacute lymphocytic thyroiditis. So it's just like Hashimoto's, except that it happens quicker. And because it damages the thyroid quickly, it results in some release of the stored up hormone in the thyroid and can cause thyroid hormone levels to go high and then low. So these are genetically probably linked. About 20% of people who have postpartum thyroiditis go on to develop Hashimoto's thyroiditis and an underactive thyroid as a result in the future. People who have baseline Hashimoto's thyroiditis may develop a wave of thyroiditis following a pregnancy, where it can be called postpartum thyroiditis. So we think that the immune system relaxes during a pregnancy in order to become tolerant to the fetus, right? So the developing fetus must be protected from the immune system. And so the immune system sort of relaxes during that time period. And then following a pregnancy, we often see the immune system come back strong. And in that first year after pregnancy, this kind of more abrupt form of thyroiditis is very common. And then we have Graves' disease. And Graves' disease, I'll talk about more in a different video. But in Graves' disease, the immune system stimulates the thyroid to be overactive. So many people who have Hashimoto's may have a family member who has Graves' disease and vice versa. Some people with Hashimoto's even go on to develop Graves' disease or vice versa. So we know that they're linked in that fashion. People with Graves' disease and postpartum thyroiditis often have antibodies to thyroperoxidase and thyroglobulin as well. So there is overlap between some of the testing, some of the features, and some of the family medical history between these different types of autoimmune thyroid disorders. So I've gone on for nearly a half an hour now, longer than I meant to, but that is an introduction to Hashimoto's thyroiditis. I hope I answered the question, what is Hashimoto's thyroiditis? And I just wanted to say once again that this channel is meant for education purposes only. It's not meant to diagnose or treat medical illness. Thanks for watching and have a great day.